Jerry Coleman. Hey, Q dog, I'm on Ozempic 1 milligram. Does it mess with your sex drive, and how can I lose my belly fat? One, it does not mess with your sex drive. The weight loss, as a matter of fact, enhances uh, uh, your sexual function because for every 5 pounds of fat that your body has, it takes 1 mile of blood flow to supply oxygen and energy to that fat. So when you lose weight, that's 1 mile less that your blood has to travel. The mechanism of erection is one of blood flow. When the blood doesn't have to flow 1 mile to supply blood and nutrients to 5 pounds of fat, you got more blood to go into the penis for an erection. Blood flows into the penis. There are valves that are like the Panama Canal that close and hold that blood inside the penis. You get a longer, harder erection. And then as you have intercourse and ejaculate, the gates open and you lose the erection. That's what happens 100% of the time. Now, one of the things that we're noticing on this class of drugs, the GLP-1s, there are two main ones, Ozempic and Mounjaro. And then those are indicated for patients with diabetes who need to lose weight. Their counterparts, Wegovy and Zepbound. Wegovy and Zepbound are the exact same drugs, but they only have the indication for weight loss. Exact same drug, they just renamed them. So either one of those will work and give you great benefit as far as your weight loss is concerned. But what we're finding out is with this class of drug is that you start to get some disenchantment in your belly. Your stomach, a lot of people will lose weight and they still got a little bulge on them. One of the things that you can do, and one of the things that we do, is highly recommend the Lipodrops Maximum Strength. The catchphrase is lose the muffin top with Lipodrops. You take the Lipodrops and our new product, the Lipo Nights, in conjunction with the GLP-1 Ozempic, and you will have a more standardized weight loss, but more importantly, you lose more fat than muscle. When you lose the GLP-1s or any weight loss method, you lose a combination of fat and muscle. For most calorie restriction diets, you lose, for every 15 pounds you lose 10 pounds fat, 5 pounds of muscle. Problem is, when you gain back all fat. So even though you may start off at 220 pounds, you lose down to 190, you look great, but then you start cheating again and you're back up to 230. The same clothes that you were wearing when you were 230 before your weight loss don't fit you anymore because now you've lost that muscle and it's gone. So you have a higher body fat content, which changes the shape of your body or your body's somatotype. When your somatotype is changed, you look different, you look doughy, you look less healthy. So you're a dough boy or a dough girl when that happens. So it's very important that you do just that to optimize that. So you can go to the website, lipodrops.com, get the Lipodrops Maximum Strength and our new Lipo Nights. This burns belly fat while you sleep and makes you lose weight. It also has melatonin in it, so you get a good night's sleep. For a previous question about multiple urination of the night, that will help you lose the belly fat, and because of the melatonin content, help you get a great night's sleep. Your body is not stressed. It does not make that cortisol stress hormone, which causes a disposition of fat in the abdominal area. So you won't have that problem. So those two things I highly recommend in addition to the Ozempic 1 milligram. Ozempic does have a maximum dose of 2 milligrams. It started off with 1 was the maximum. Now it goes up to 2 milligrams. I find that most people do quite well on the 1, so I don't necessarily titrate them up to the 2. But if you find you're not losing enough weight, not losing it fast enough, or that you have plateaued, you were losing and now you're stopping, then going up to the 1 milligram dose would be the next way to go. Now, and there's no in between. 1 milligram, 2 milligrams, the next dose up. So if that is an option for you, depending upon how long you've been on the 1 milligram and how successful you've been with the 1 milligram, you might want to consider having your provider, physician, increase the dose to 2 milligrams. But if you're doing great on the 1 milligram, just stick with it. And the question is then, when do you stop it? Do you stop it? Do you stay on it? That is a question that depends upon the patient. I have patients that have great success with it and then stop. But if you're taking the Ozempic for diabetes, you'll stay on it. You'll keep staying on it to keep your diabetes controlled because it lowers your blood sugar. It lowers your hemoglobin A1C to great levels, keeps you off of insulin, and also helps improve your kidney function, which is one of the bad things that happens with diabetes. Okay, great question, Jerry.